You may be seated. Welcome to the 49th Greenfield Community College Associate Degree Nursing Program's annual pinning ceremony. My name is Nancy Craig Williams. I am the program coordinator of the nursing program, soon to be the assistant dean. Thank you. On behalf of the faculty and students here, I'd like to thank you all for coming to share this very celebration with the students. A pinning ceremony is a traditional rite of passage in the life of a nurse. I'd like to offer a special welcome to our nursing colleagues, currently or active or retired, including any past graduates of our program who might be in the audience. It would be an honor for us to have you stand and be recognized. Thank you. I would also like to thank the members of the class of 2015 who are acting as ambassadors for this evening's program. A special thanks to Nancy Stalins, our administrative assistant, the pinning committee, and the GCC staff for helping to make this such a special occasion. I'd like to introduce our distinguished guests on the podium. First, Dr. Robert Pura, the president of Greenfield Community College. Dr. Cher Haruska, our Chief Academic Officer. Terry Lynn, our Dean of Professional Studies. And Jean Simmons. Jean is our Professor Emeritus of the Nursing Program, who is our invaluable and special advisor. I'd now like to introduce the faculty, our full-time faculty, starting with Sherry Ducharme. Sherry is the coordinator of our Sim Lab and Skills Lab and teaches pediatrics. Mary Dent. Mary teaches in the Fundamentals course, Maternity and Pediatrics course. Mary Phillips. Mary teaches Fundamentals of Nursing and the Maternal Child course. Lauren Bell. Lauren teaches in our Medical Surgical 1 and 2 courses. Lori Munier. Lori teaches in our Medical Surgical 1 and 2 courses as well. Melanie Zamoski. Melanie has coordinated our service learning program this year and is a clinical instructor in the Medical Surgical 1 and 2 courses. We are fortunate also on our faculty to have some very talented, skilled, and wonderful clinical instructors, and I'd like to introduce them. Mary Lisa Murphy. Mary Lisa is a clinical instructor for this class at Medical Surgical Nursing. Sharon Levinson. Sharon is a clinical instructor in our mental health nursing course. Jennifer Kozakowski. Jennifer is a clinical instructor in our Medical Surgical 1 and 2 classes as well. And Lee Griffin. Lee is also a clinical instructor in our Medical Surgical 1 and 2 courses. Okay. Welcome to all of you. And now I'd like to ask Dr. Pura to offer us a greeting for this evening.
Thanks, Nancy. Hello, everybody.
Hello.
So welcome, and congratulations to the nurses and to all of you who helped these folks achieve this wonderful moment. Congratulations also to our nursing faculty. You've done really well. I want to take a moment to first recognize Dean Terry Lynn. Dean Lynn has been steadfast in his support for the nursing program, and he really has provided the leadership to establish the ADN to BSN completion program here at GCC. Unfortunately for GCC, Dean Lin has accepted a position in New York City. The only good news is that I know Terry well enough to know that he will never succumb to supporting the dreaded Yankees and will always be a member of Red Sox Nation. So please join me in thanking Dean Lin for his heart, his passion, and his leadership all during the time he was here at GCC. Terry, we do wish you nothing but the very best, and we're grateful for the time that you have spent here at GCC. So thank you. Nancy Craig Williams, however, is going nowhere. In fact, I am happy to announce, as she just did, that she has accepted our offer to become the Assistant Dean of Nursing here at GCC. Please join me in congratulating Nancy and more, thanking her for the leadership she will bring to her new position. Well, you sure have picked a great time to become a nurse. No, I mean it. Healthcare has never been more challenging, nor has there ever been a more significant moment for the need for quality nursing. So let me just share three very quick, I promise quick, but I believe important little tidbits for each of you in this class of 2014. One, as a nurse, you really are the most important tool in your toolbox. You know, you go to someone's garage, and if they're really good at working on cars, they take really good care of all those tools, and you could see how they will shine them up and put them away properly. You go to the tech center here, and all the IT people know exactly where everything is, and they take great care of all their tools. You are the most important tool anywhere to be found in nursing. You are the tool that you will need to take care of. So my advice is really make sure that that is a purposeful part of your strategic plan, and for your career trajectory, you need to take care of yourself. You will do no good for your patients if you are not taking care of yourself. Number two, you have learned from the best about becoming the best. You will get a nursing position, and the culture of that healthcare organization might change procedures or protocols from which you have learned here at GCC. Difference is okay, as long as difference does not mean not as good. Trust the compass that has been planted here at GCC. Point number three, as I stated earlier, and as all of you know, healthcare is a very complex environment right now. In fact, I just learned that you picked black and white to be your colors for the evening. It might be the last time that everything is as clear and black and white as tonight. So healthcare is very complex, and it will only become more so. Rising costs, new technology, old technology, quality metrics, insurance metrics, the politics of healthcare, on and on and on the list goes. It will be very easy for you to get sucked down into that swirl. Stay focused on why you are there as a nurse. Your patients and their healing is the answer to why. You will never, ever, ever go wrong when you are guided by the question, what is best for my patient? Nurses, on behalf of all of us here at GCC, I bring our entire college's heartfelt congratulations to you all. Congratulations.
Thank you, Dr. Pura. Dean Lin, Terry Lin, would like to say a few words as well. Terry?
Welcome. Congratulations to all of you. What a journey it's been. I was there to welcome you when you first came in. I've seen the laughter, the tears, the sometimes 3-letter, 4-letter, 8-letter words that were uttered out of the professional studies lounge after exams. When I took the position overseeing as the Dean of Nursing, I thought, how hard could it be working with nursing? I learned very quickly, and boy, you know what? It's probably one of the best things I've ever done in my entire life. You know, being a non-nurse, to truly appreciate what you folks go through to become a nurse. I tell the story often. When we first moved out here 3 years ago, our son was born prematurely. And down at Bay State Hospital, it was in Sue Sweeney's care that our son, Tristan, from 2 pounds, 6 ounces, is now our baby Moose. Just, again, a true appreciation for that. So, you know, really when I came up here, it was 3 things. 1, welcome. 2, I just want to talk about these nurse educators behind me. At times, it may not have felt as if they were your best friend or ally, but they were your biggest champion. They were. Something wonderful happened the other day. I was sitting with Dean Craig Williams, and Professor Bell and Munia came in, and Lauren turned around and said, "Nobody failed." And there's just something about that joy, that gleam, you know, in their eye to know that they challenged you. I know they did. And I don't think any of you in here you do truly appreciate what they've done for you when you go out there, and you are the best trained technical nurses in the area. They did a really good job. And the third thing that I want to say as the dean is that sometimes when you meet people, whether it's a nurse in a hospital, a teacher that you had in school, sometimes they made a difference in your life, and you say, you know what, I'm going to write them a letter and say thank you. And then sometimes life happens and we forget, and a year goes by, and 2 years go by. I didn't want to turn around and take that opportunity, to lose that opportunity here tonight. And so I want to turn around and say to Melanie, to Lauren, to Lori, to Mary, to Sherry, to Nancy out there, and Jean. You made a difference in my life. I'm a better man for it. I'm a better person for it. I'm a better husband for it. I'm a better father for it. I care about you deeply. I respect you immensely. I will miss you, and I love each and every one of you. Thank you. Congratulations.
Thank you, Terry. I'm all choked up. It's going to take me a minute to kind of recover. Excuse me. So we shall continue on. The students have chosen for their class speaker Jamie Strakos Hagen to represent them and say a few words. So please join me in welcoming Jamie to the podium.
Good evening, everyone. Thank you for joining us on this special occasion. I would like to start by thanking all of our faculty, as well as our president, Bob Pura, and Terry Lynn. Thank you for teaching us and helping us reach this next step to become a nurse. Thank you to our clinical instructors for giving us the confidence we needed. I would also like to congratulate Melanie Zamoyski on completing her master's degree and first year as full-time faculty and service learning coordinator. Congratulations to Nancy Craig Williams on her promotion to Assistant Dean of Nursing. Give her another round of applause. And Mary Phillips on her promotion to Assistant Professor. I would also like to thank Nancy Stalins, over there. You are the binding to our book, and without you, we would be a bunch of loose leaf paper. Thank you. You are amazing. Also, I'd like to throw out a huge thank you to the library and the 7,000 acres of trees worth of paper we have used. Next, I would like to thank all of our family, partners, and friends for supporting us on this journey, which until now felt like it would never end. All the time we have spent away from you these past 2 years has been a sacrifice on both ends. We had to give up a little time out of our lives to be able to help others for a long time, which is what we love to do. Nursing is not just a job, but a lifestyle. It is not black or white, but many different colors, and at times not the prettiest. I don't know about you, but puke green is not a good color. We as nurses utilize our mind and our body 100% on the job. It is one of the most tiring yet rewarding careers I know of. We are at the beginning of our long-term goal and the end of what was our short-term goal, nursing school. Our class had started off as 40 strangers, and we are now ending as a strong team. If one of us falls, the rest are there to catch them, and I am so thankful to be a part of such a close-knit group. We bring many things to the table as a whole: diversity, loyalty, courage, acceptance, and the willingness to learn. I wouldn't trade these past 2 years with this group for anything. I have compiled a list of experiences that I and others have had as a nursing student. I will forever miss Facebook pictures of Ryan Gosling telling me to finish that care plan. Round of applause for him, right? For those of you that lived off ramen noodles, we are on to bigger and better things now. I also did not know that the following things were even remotely possible: going through an entire pen's worth of ink in less than a month, or how about wearing out a single highlighter studying for just one exam. Another highlighted nursing student moment: it's first thing in the morning, and you're getting ready to take vitals, and you grab the machine because you're on a mission, only to get flung backwards because, oops, it's still plugged in. And you look around and pray nobody's watching you. It's really funny in the moment. Another tip: always make sure the bed is locked when you go into a patient's room. Remember fundamentals? They weren't kidding. During one of our projects, I went to start CPR in the lab, and I'm getting ready to start pumping away, and that bed goes flying. Thank goodness this didn't happen on a real person, but it was hysterical. It's moments like this where you really learn, and you can look back and laugh at them. We may have lost relationships in these past few years, but we have certainly gained some. Ever go out with a group of nurses? The things we can stomach talking about over dinner would make others lose theirs. We have become a part of this culture now. No one else is going to understand that smell that doesn't leave your nose for days, or the amount of stool you've cleaned up in just 1 hour, or how you just put on sterile gloves and your forehead starts to itch. Sleepless nights, endless coffees, 30-plus page care plans, refreshing your computer over and over and over again, praying that you pass that exam. Those jolly green uniforms, getting up at 4:30 a.m. for clinical, and at the same time being able to manage your personal life, because life doesn't just stop when you're in nursing school. We have shared every emotion imaginable with each other, and that is invaluable. We have been told we are a very literal group. We have lots of questions, and if there's a mistake anywhere, we will find it. But isn't that what being a student's all about? If there's one thing that I can leave you with today, let it be this: don't ever lose your passion, your hunger to learn, or your ability to think through a problem. I am so proud to be a part of this inspiring group. Remember, you got yourselves this far, and no one can ever take that knowledge from you. Congratulations to the class of 2014. We did it. Thank you.
Thank you, Jamie. It is amazing sometimes that you get through it, isn't it? Next, the class of 2014 has chosen faculty member Mary Phillips to be their guest speaker. So please help me to welcome Mary to the podium.
Good evening. Yes, I do get nervous. So I thought I would start out with something that looks a little familiar to you guys, a little something called a PowerPoint. The beginning of your journey of understanding what the nursing process is. Readiness for enhanced learning related to excitement of entering nursing school, as evidenced by sitting in orientation and feverishly writing notes that will lead to success. Knowledge deficit related to first exam grades, as evidenced by grumbling about grades and exam questions. Sleep deprivation related to exam cramming, as evidenced by periodic head bobbing during lecture and larger cups of coffee during class and at exams. Activity intolerance related to lack of movement, secondary to sitting for extended periods of time, developing 40-page care plans, as evidenced by inability to walk upstairs without being short of breath. Risk for self-injury related to carrying 200 pounds worth of nursing school books. And finally, readiness for enhanced management of therapeutic regime related to completion of the nursing program. What is all that jargon? Amongst all of the skills you have learned, you have each learned this thing called the nursing process. What is that exactly? The non-nursing people in the room might wonder. It is a process in which we develop the ability to care for our patients and then evaluate that care. While you listen to a shift report, you can all now develop nursing diagnoses in your head on your way to the patient's room. What you learn to do beyond that, and will continue to learn, is to alter your path based on critical thinking skills and focus on what the patient actually presents with. For example, in shift report, you hear all about your patient with cellulitis of the lower leg. And you develop a picture in your mind of the plan for that patient's care, which I can see some of you are doing currently. But when you walk into the patient's room, your patient is on the floor and bleeding. Suddenly your priority isn't the swollen leg anymore. The difference between your first plan and your new plan is addressing the fall. But it doesn't stop there. You then must begin investigating the steps that led to that fall. Without knowing the cause, there is no way to prevent it from happening again. This is all part of the circular process you have learned throughout the 2 years you have been with us. Nothing in nursing is clear-cut or textbook in most cases. What is my general answer to your questions in class? Good job. You guys were all paying attention. It depends. While the above example is a clear-cut picture, I think you're all able to follow the process. There is nothing robotic about being a nurse. It is more like a process of constantly assessing and reassessing your plan. I liken it to watching a live movie in which my actions can alter the outcome. I am always taking in the data in front of me, evaluating and deciding the next steps based on the information gathered. Experience has taught me that it is important to always keep an open mind to learning. Add new experiences, both positive and negative, to your tool belt of knowledge. It is this tool belt that you will draw from and will help to develop that gut feeling that has been so often referred to with the experienced nurse. I will leave you with a bit of wisdom I stole from last year's speech. The journey you are only just beginning has no limits. I think based on the last 2 years, you have all learned that each of you has the capacity to dig deeper into your mind, body, and souls than you ever thought possible. You all have shown such growth and strength that my hope is that you take that confidence and hold it tight when you enter this next phase. You know more than you think you do. Reflect back on the days of only just learning to develop a nursing care plan. Many of you may have thought, what is a nursing care plan? How do you word that diagnosis? I know this perspective to be alive and well right here in this room, as I overheard a now second year, standing back there, say, remember fundamentals, the notes we took purposefully, writing I and O equals intake and output. And now, that seems almost silly to have noted something so basic. Yet when it was new, it was important. And your whole career should be one reflection and change of perspective after another as you gain experience and confidence. Trust me when I say you are sitting here because you earned that seat and these pins. You are ready. The GCC Associate Degree Nursing Program does not have the reputation and the NCLEX pass rates that we do because we do not prepare you. We push you, and we do this because we see the potential and the ability, and we just need you to realize that. Just last week, I had a student thank me. I wasn't quite sure for just what until she said with vigor, "You were so hard on me, but I needed that, and I appreciated you pushing me. I learned so much." This all occurred in front of President Pura, which you can well imagine made me blush. I will never apologize for raising the bar that you have all reached by sitting here. However, refraining from making me sound mean in front of the top dog would be great. Seriously, I can't make this stuff up. True story. Anyway, we know you can and will complete this final step, leaving us looking forward to the day when we are colleagues instead of teachers and students. Nicely done. We wish you all the best of luck in each of your paths. Don't forget us and come by and visit.
Thank you. Our next presenter is Haley Perrette, who is coming to present the class gift.
Hello. So on behalf of the graduating class of 2014, I wanted to present a donation of $1,200 to our simulation lab. It is in SimLab where we practice and strengthen our skills that we use in the field every day. Thank you.
Wow, we knew you wanted more simulation, but this is great. Thank you so much. Thank you, Haley, for coming and presenting this. So many members of this class have already benefited from very generous scholarship and award programs offered by the GCC Foundation. In addition, this class has received significant financial support from our very generous anonymous donors to the nursing program. It is my pleasure to announce that thanks to the generosity of those donors, we are able to award 3 additional scholarships this year chosen by the faculty. Please join me in congratulating these scholarship winners. So if you would come up when I announce your name, please. The first one is for outstanding performance in pediatric nursing, and that goes to Kara Hayes. Our second award goes to Beverly Gibalt for outstanding performance in mental health nursing. And great shoes. Our third presentation is for outstanding performance in medical surgical nursing, and that goes to Tiffany Summers. In addition, 2 scholarships will be given on graduation, and so you can stay in your seats, but I do want to announce them because I know some of you may or may not be there. And these recipients are Andrea Gray, Christy Timberlake. On the GCC Scholarship Day, the Florence Ross and Bramley Scholarship for an outstanding student in maternity nursing was awarded to Michelle Brennan. She was unable to come, and so I asked if we could present it today, and she agreed. This evening, you will each receive your GCC, Greenfield Community College, nursing pin, depicted on the front of your program. You will notice the pin has a symbol and an inscription. The symbol is the lamp of knowledge. May it inspire you to sustain the energy and enthusiasm for the pursuit of knowledge you have demonstrated during your time here at GCC throughout your professional career. The inscription reads, "The right to think, the will to learn." You are caring, thinking men and women. May you continue to demonstrate the independent, critical thinking you have developed to learn and to make a difference in the world of nursing that you enter today, as you have here at GCC. After receiving this nursing pin, the graduating nurse also receives a charge, the responsibilities implicit in our profession of nursing. Today I have the honor, and on behalf of the full nursing faculty, to charge each member of the class. The nursing faculty, as you join us as professional colleagues, charge you with the following responsibilities: the consistent delivery of knowledgeable, skillful, safe, quality nursing care, self-reflection, demonstration of legal and ethical practice and decision-making, cultural awareness and competence, collaboration and respect for all of your professional and nursing colleagues, and nurturing of yourself. These are not new responsibilities for the class of 2014. During your 2 years as a GCC nursing student, you have provided individually approximately 654 hours of patient care and education in your clinical settings. That is 26,160 hours as a class. In addition, you have spent approximately 40 hours, and I know those who went to Haiti spent more, of hours of service learning individually, and approximately 966.5 hours as a class. This is a stunning contribution to the community. As a class, you have recognized and supported each other's individuality, worked to ensure success for all, and you have cared for each other emotionally and sometimes physically. As Jamie commented in our meeting on Wednesday, you have become a family. You have grown and developed and evolved into novice nurses as you have integrated all you have learned into your daily lives in the classroom and clinical settings. May you bring all of this as you begin a great journey, pursuing your dreams and career aspirations and contributing to the health and welfare of your patients. We, the nursing faculty, charge you with upholding the responsibilities inherent in your chosen profession in accepting these pins. Do you accept this charge? Yes. We may now begin our pinning. Our first recipient is Lata Bonner. Sarah Bowl. Mary Bordewick. Sorry, Mary.
Good job with that.
Erica Breedy. Michaela Brennan. Deborah Brewer.
You did it. I know. We knew you could do it.
Louis Chase. Dmitry Donchev. Anna Gensha. Andrea Gray. Beverly Giebald. Bethany Harden.
Thank you.
Tara Hayes. Ariana Heyer. Tara Johnson. Victoria Casanova. Jenny Lambert. Susan Lasese Delisa. Rana Letourneau. Ludmila Leventuk. Aveen Mahmood. Olivia McDowell. Jill McFadden. Jian Mohammed. Catherine Newport.
I miss you, Nan. I love you.
Beth Ann Ortiz. Haley Perrette. But we need like a group hug or something. That's for them. Todd Perry.
Thank you, my dear.
Oh, thank you. Congratulations. Dorina Placinta. Thank you. Keep us posted. She made it. I know. Christy Porter. Thank you. Natalia Radonova. Michelle Ryan. Wyatt Sherm Martin. Mikhail Siniokov. Jamie Strakos Hagen.
Thank you.
Tiffany Summers.
Thank you.
Christy Timberlake. Andrea Williams. And Zachary Zucker.
Thanks a lot. Please join me in giving the whole class a warm round of applause.
I will ask the audience to please be seated while the graduates stand, face your friends and family, and recite the LaSalle Nursing Pledge. In This concludes our 49th pinning ceremony. On behalf of the graduates, I'd like to invite you for refreshments. So let us all stand for the recessional.